Hi everyone, we're going to be going through the Newport E100M ventilator. Just given the current COVID pandemic, we need to be able to use more ventilators and have a bigger variety of machines available to us. So this is one that I'm going to go through with you. It's an older machine and a lot simpler than our more modern electronic ventilators, but there's certainly nothing wrong with it as a ventilator, and we've previously ventilated many patients successfully with this machine. So to start off with, I just want to point out a few general features of the machine which make it a little different and that you need to be aware of. The first thing is if we look at the back of the machine, you'll see that this machine needs to be plugged into both air and oxygen. So there are two hoses that need to be connected into the wall, one for oxygen and one for air. Most of our newer ventilators only use an oxygen connector, but these both need to be plugged in. Like other ventilators, we need to plug the electrical supply in to the wall, and we need to switch the ventilator on, and the on switch is at the back of the machine on the bottom left hand side. Just looking at some other things that make the machine a little different, you'll see there's a reservoir bag hanging underneath the machine, and that reservoir bag is there so that the patient can take spontaneous breaths, where the spontaneous breath flow rate may exceed the flow rate being delivered by the machine. So it needs to be there. If we come around to the front of the machine, then just to point out that we've got a bacterial filter on the expiratory limb of the circuit. Please make sure it's always there. And we've got a rotameter on the side of the machine, which I'll go through the detail of in a little more in a few moments' time. And then last of all, because this ventilator doesn't have a humidifier on it, if you are ventilating a patient with this ventilator, then please make sure there's a heat moisture exchanger in the circuit before you connect it to the patient. Okay. Right, so we're going to go through connecting the ventilator up. I'll just plug the electrical supply into the wall, and we're going to connect up the gas connections. And just to make you all aware, because the machine's got an old style blender in it, if we don't have both of these plugged in correctly, the machine's going to make a loud squeak from the blender. So I'm just going to plug the air in first. And you can hear now, that's the blender making that noise. And the reason the blender is making the noise is because there's no oxygen connected. So I'm going to go and connect the oxygen. Okay, and you hear the blender is quiet. If I disconnect the air, okay, you hear that the machine will manage with 100% oxygen. It doesn't mind the air being unplugged. But if you hear the blender squeaking, you know that you don't have both gas, you don't have the oxygen supply plugged in properly. All right, I'm going to switch the ventilator on the back of the machine, and then I just want to go through some of the features on the machine that we need to talk about. I think first of all is just to notice that there's a rotameter here. I mentioned it previously on the left hand side of the machine. There's a little switch here on the side which most people tend not even to be aware of, and we'll discuss what that does in a few minutes. On the left hand side of the machine here, we've got the dial for setting the FiO2 that the patient's going to get. And then in the main panel of the machine, we've got alarms at the top of the machine. We've got a pressure gauge which can read a number of different pressures for us. And then we've got a setting panel just below it, where the machine will tell us what the IE ratio, the total breath rate, and the tidal volume are for the patient. We can set alarm limits. We can set the inspiratory flow rate for the machine. We can set the inspiratory time and the total breath rate. And you'll see that the so-called normal settings for an average patient are highlighted in green. Okay, and then last of all, on the bottom row of the machine, we've got a manual inflation button We've got a time limited demand flow setting. We've got the PEEP setting for the machine, and we've got a pressure limit valve. So the next thing we're going to look at on the machine is just the various modes of ventilation that are available to us, and then we'll go through some of the settings of those modes. So if you have a look, here's the mode selector on the machine, and you can see that there are a number of modes that we can select. The first one there is SPONT. It's for spontaneous respiration. The patient can just breathe through the circuit of the machine and the machine will do nothing. The next setting is spontaneous respiration with an apnea backup. So if the machine detects an apnea in terms of a number of seconds that we can select, and the patient hasn't taken a breath within that period of time, the machine will initiate backup ventilation. Then there's SIMV, so that's synchronized intermittent mandatory ventilation, which we'll talk a little bit more just now, but just to make you aware that this ventilator doesn't do SIMV with pressure support. So the machine does SIMV, and it does allow the patient to breathe spontaneously, but the spontaneous breaths are not pressure supported. And then the last mode that we have on the ventilator is assist control mandatory ventilation, which is the simplest mode of ventilation available on this ventilator. So I'm just going to go through setting assist control to start off with and explain to you some of the features of it. So I think to understand what assist control is, the ventilator can either assist the patient, in other words, when the patient initiates a breath, the machine will deliver the breath at the same time. It's a little bit like you squeezing an ambu bag, and when you see the patient wants to take a breath, you squeeze the bag at the moment you see the patient taking the breath. So that's assisted ventilation. And then if the patient makes no effort at all, then the machine will deliver its own mandatory ventilation. So that's like you squeezing a manual resuscitator bag when the patient's making no effort. So assist control, then the machine will either assist or control the breath, depending on whether or not the patient makes any effort. So I'm just going to go through the settings on assist control as we have it at the moment. So the patient's set up to get 20 breaths a minute, so that's one breath cycle every 3 seconds. And the inspiratory time I've set there to be 1 second. So clearly if there's 1 second of inspiration in a 3-second respiratory cycle, then the IE ratio should be 1 to 2. The next thing we've got here is the inspiratory flow rate. And it's important then to realize that on this ventilator you don't set a tidal volume directly. Because we've set an inspiratory time and we set an inspiratory flow rate, the machine will deliver the flow rate we set for the amount of time that we've chosen. So if we set the inspiratory flow rate on 30 liters a minute, clearly 30 liters in 60 seconds must be the same as a half a liter per second. Then in the 1 second that we've set as inspiratory time, then the machine should deliver a tidal volume of 500 mils. And we can check that on the panel with the LED display. So I'm just going to tweak it, but you'll see the tidal volume is very, very close to 500 mils. The IE ratio is almost exactly 1 to 2, which is what we set. And the total breath rate at the moment is 20. Remember, the total breath rate is 20 because we've set 20 and there's no patient breathing on the circuit. Once we've got those settings taken care of, we need to set up the alarms on the machine. So if we look at the first alarm setting we have here, it's for the upper and lower airway pressure alarm. The upper pressure alarm as a limit to prevent patient injury, and the lower pressure alarm to detect disconnects from the ventilator. And we can move the alarm settings by turning the dial, and you'll see there the upper and lower pressure limits scrolling around as I turn the dial. And if we want to move the limits independently, you see they're moving in tandem there, then I can push the dial in and turn, and you can see there I've got the upper airway pressure limit moving on its own. When you're actually setting a patient up and you're starting off and you're uncertain as to where things go, then what you can do is push this little panel which says AS. Okay, that's the auto setting for the alarm limit. So if I push it, the machine will monitor a breath or two, and then it will adjust the pressure limits automatically. And there you can see it's done it. The one disadvantage of the automatic setting is it tends to make the upper airway pressure limit quite low. So once I've got the auto setting done for the lower pressure limit, it's useful just to push the dial in and raise the upper pressure limit to about 40 centimeters of water. The next setting we have over here is the trigger for the machine. So that's for the machine to be able to detect patient effort. And again, if we want to, we can use the automatic trigger control on the machine. So the machine will set the trigger automatically. So if I push the automatic trigger, you'll be able to see the little trigger bar there in the bottom of the pressure manometer. And every time the pressure then drops to that level, the machine would detect a patient effort. So I'm just going to fiddle with the bag on the end here just so to try and mimic some patient breaths. And if you look here now, you'll see the spont light up, and that's the machine thinking it's detecting a trigger. And every time the machine detects a trigger, it delivers a preset breath. So if I try and trigger the machine a little faster, and you look at the respiratory rate there in the respiratory rate panel, you'll see it's risen above 20 now. So the machine is giving additional breaths in response to my triggering. All right, and then just above the trigger setting over here, we've got a selector which we can use to get the machine to display the peak airway pressure, the mean airway pressure, and the base pressure for the machine. The base pressure is just another way of saying the PEEP that's been set on the machine. Because we've got to the PEEP monitoring here, I'm going to skip ahead to setting PEEP. And to set PEEP, we use the third dial in the bottom row, and we wind that slowly to increase the PEEP level. And while we change the setting here, we watch constantly what the machine is reading the baseline pressure as in that central display. So I've increased the PEEP setting now. You'll see it's on 7. I'm going to make it 8. And you'll notice that an interesting phenomenon has started to take place. And that is the machine is auto-triggering. The reason the machine is auto-triggering is I haven't gone and adjusted the trigger setting. So with the PEEP being higher, the patient is meeting the criteria for a trigger with every breath. Okay, I'm just going to take the trigger and set the trigger higher. Sorry, set the trigger lower. Okay, there you see the auto-triggering has stopped. You'll see because there's no auto-triggering, the baseline pressure has changed. So I need to go and adjust the PEEP setting on the machine now. And I said we'd go for about 8. There we go. I'm getting there. Once we get our PEEP setting where we want it to be, and we want the patient to trigger again, then we can switch the trigger control on again on the ventilator. And now if I squeeze the bag, I'm able to make the patient trigger the ventilator as was happening earlier. So that goes through the basic settings of a mode like assist control and the monitoring panel of the machine. And then just to go through some of the last details on the bottom row, the first button here says manual inflation, and all that will happen is every time I push the manual inflation button in any mode, the machine will deliver a preset breath. The next setting here is the time limited demand flow. So time limited demand flow is not active in assist control ventilation. You'll see there's no light on there, and when we choose a mode in which it's active, I'll explain it to you. And then the last setting we've got here is the ultimate upper pressure limit that the machine will deliver, and that's usually set by our technicians in our ventilator store. And I'd suggest to all of you that you don't tamper with the setting of the upper pressure limit unless you really know what it is you're doing with the ventilator. Last two little buttons on the bottom here. The first one is neb. So if we switch that on, we can get the ventilator to drive a nebulizer. You can hear the gas coming out of it, and that just coincides the nebulizer activity with inspiration on the ventilator. And then the last thing here is where we want the machine to sense the pressure. So if we have it on proximal, then the machine will sense the pressure inside the circuit. If we change it, we can get the machine to sense the pressure at a different part of the circuit. I don't think it's particularly crucial to worry enormously about that setting. All right, so that's assist control ventilation, all set up on the central panel, and of course we have to set the FiO2. We're now going to leave assist control ventilation and we're going to go to SIMV. We're going to move on to setting SIMV now on the machine. So I'm going to switch the selector, the mode selector, from assist control to SIMV. And really all of the settings that I discussed with you that were relevant for assist control are all active in SIMV. But you will see now that the little light has come on next to the time limited demand flow. So I said to you that this ventilator doesn't have pressure support. So the SIMV breaths are all delivered in terms of the settings that we've got there, just like the assist breaths in assist control. But if the patient now wants to take additional breaths, so they want to breathe more than 20 breaths a minute, then the breaths will be supported by the time-limited demand flow. In most modern ventilators, they'd be supported with pressure support. So I think just to emphasize to all of you, the difference between assist control and SIMV. In assist control, we set 20 breaths, and if the patient took any additional breaths, then they were all assisted with exactly the same settings as a control breath would have, same tidal volume, same flow rate. In SIMV, the patient will get 20 breaths set up exactly as they were with assist control. But if the patient wants to take additional breaths now, those additional breaths will not be delivered as preset breaths as they would be in assist control. The additional breaths will be supported by the time-limited demand flow. So time-limited demand flow brings into it two issues. One is the time, and the second is the flow. So the actual setting that we have here is for an amount of time that we want the machine to make flow available to the patient. And you'll see that the green setting is a half a second. In other words, for the first half second of the patient's inspiratory effort, the machine will make a flow of gas available in terms of our preset flow rates. But clearly, many patients may want to take an inspiration of more than a half a second's duration. If that were the case, you'd have to increase the setting to make the time that the ventilator will make the flow rate available to the patient approximately the same duration as the patient's respiration. And that we can obviously either increase or decrease away from the green setting that's given on the machine. And then just again to emphasize that in time-limited demand flow, the flow that the patient is going to get is the preset flow that we had on the ventilator. All right. We're going to shift then from the setting of SIMV to the spontaneous modes. There are two of them. The first one, spontaneous mode with an apnea assist control backup, and the second one, just spontaneous breathing. So I'm going to shift the selector in a moment to go into spontaneous with apnea assist control backup. And just to say that the backup breaths then would be delivered as preset breaths in the other mode. And for the spontaneous mode with apnea backup, we can select the amount of seconds that the machine will wait before providing backup ventilation. So at the moment I've set it to wait 15 seconds before the backup mode kicks in. And so what I'm going to do is I'm going to switch the machine into the spontaneous mode, but clearly we're not going to trigger the machine. So after 15 seconds have elapsed, the machine should detect that there's apnea and it should start to provide automatic backup for the patient. There the apnea alarm goes. You can see it's flashing. I'm just going to adjust the upper pressure airway limit. And I'm going to silence the alarm. But clearly you can see that the apnea light is flashing continuously and the machine remains in the apnea backup mode. To be able to take that alarm away, the patient needs to breathe. So I'm going to try and make the machine detect triggers. And once the machine has satisfied itself that it's detecting regular triggers from the patient, the apnea light will stop flashing and will become a solid light, as you see there. Once the solid light is on, I can clear the alarm, and if the patient continues to breathe spontaneously, the machine will be satisfied. Again, if the patient stops breathing now, after 15 seconds, the apnea light will start to flash and the machine will commence with its backup ventilation. I'm going to go now, though, to the spontaneous mode. So this is spontaneous mode without apnea backup. And you'll see the difference now is the machine detects that there's an apnea. The patient hasn't taken a breath for 15 seconds, but the machine just alarms. It doesn't initiate any backup ventilation. If I start to breathe now, you can see the light stops flashing, and I can go and clear the alarm, and the machine will continue to allow the patient to breathe spontaneously. But again, if there are no patient efforts detected, then the machine will just alarm for apnea. It won't commence any automatic ventilation. Okay, we should be close to 15 seconds now. There you go, the light starts to flash again. The reason you're not hearing the alarm is the alarm is still silenced from the last time that I pushed it. There you go, you can hear the alarm. Again, it doesn't matter how many times I push the alarm reset button, I can't stop the machine from flashing the apnea alarm. The patient has to commence respiration. All right, what I want to do now is explain a little bit to you about where the patient gets air from during spontaneous respiration. And to be able to explain it to you and to stop the machine alarming, I'm just going to switch the machine to a different mode of ventilation. So it's on assist control. So as far as the spont mode goes, there are two sources of gas for the patient to breathe from. The first source of gas is this rotameter, which we can dial from 1 to 15 liters a minute. And when I switch this rotameter on, what the machine will do is it will deliver gas at a preset FiO2 into the circuit and into the reservoir bag. That's the first setting we have in terms of gas supply for a patient breathing spontaneously. The second source we have is governed by this little switch. So if I open the gate here, I can then switch the switch up and down. If I switch it up, it says 8 liters a minute. If I switch it down, it's off. So if the switch is switched down, then there's no gas flow for spontaneous breathing from here, and all of the flow for spontaneous breathing is from the rotameter. If I switch this up, then the machine's delivering 8 liters per minute as a preset, plus whatever I've dialed in the rotameter. Just to remind you though, that all the rotameter and the switch do is determine what the flow rate of gas will be into the circuit and into the reservoir bag for the patient to breathe spontaneously. When we were discussing Simv and we were discussing time-limited demand flow, I indicated to you that the flow that would be available would be a flow that we'd preset on the machine. In the spontaneous modes, the patient decides the inspiratory flow rate and the machine just makes fresh gas available. So I hope that is introduced you all to some of the features of this ventilator. And just to say to you that the two modes that I think you will probably find most useful are the assist control mode first and foremost. As you move towards weaning a patient, the Simv mode with the time-limited demand flow. And then if you do want to do a spontaneous breathing trial, if you put the patient onto a spont mode, it's exactly the same as putting a patient onto a T-piece. Thank you.